Thank you for joining us. My name is Helen, and I will be facilitating today's office hours with Dr. Cheap. Before we get started, this webinar is recorded and will be uploaded to Glidewell TV for you to stream. If you have any questions throughout the presentation, please submit them in the Q&A section and we'll address them afterwards. And with that said, I'll hand it over to you, Dr. Chi.
All right, thank you, Helen. Good morning or good afternoon to everyone. Thank you for tuning in to today's office hours. I'm going to go ahead and share my screen here. And today's topic is bridges. So we're going to jump into the material options for bridges. So starting off with our PMMA block, the BioTemps Now bridge block. This bridge block comes in at about 40 millimeters long by 14 by 15 in depth. So this block, again, PMMA acrylic material. This can be used on both anterior and posterior applications. How many units it can accommodate, it can go as little as 2 units, and I have personally seen up to 6 units in the mandibular anterior zone. So it just kind of depends on the width of the teeth and the span and where you're kind of at in the arch. So if the span or even the height, especially in the posterior, if maybe you're working in a situation where the patient has a pretty deep curve of spee, that may push the arc of the bridge outside of the dimensions. So just something to consider as you're designing these, the location, and then just kind of how it's fitting in the block. The system in design does have a feature where it tries to analyze starting from the position of the margins, whether or not it can be accommodated. And I have seen even when the limit warning is triggered. So if you're in the margin section and it tells you your design may not be able to fit in the block, I have still seen moving forward into design just to kind of quickly see the arrangement of the teeth. I was able to kind of sneak in the height of one of the designs to fit within the block. And another thing to consider, which we'll review when we get to design, is the insertion direction. Sometimes the insertion direction can be adjusted to also allow for the design to fit in the block. So little tangent there with the design, but we'll dive into that in a little more detail in a few minutes. As far as the time to manufacture these can take as little as 15 minutes, and I've seen up to 30 minutes of mill time. It is dependent upon the size and kind of location of the restorations. So just really quick, for the delivery of these, any provisional cement will do. This material coming out of the mill, well, really all the materials coming out of the mill, the intaglio aspect is very, very smooth. So the retention of these can be somewhat challenging because the material is designed to be removed, but we need to hold it in long enough. So I'm going to show you my protocol to bond these in, or better bond these in for retention for a longer term provisional. All right, so that is our PMMA block. And just another note on this, it is a bridge block due to the size, and you can actually make splinted units with this. So for example, the 3-unit bridge that you see, there doesn't have to be a ponic there. So those could actually be 3 crowns in a row that are splinted. So if you have a situation where you want to provisionalize a long span of crowns, you can do so in this bridge block. The downside to doing that is if you're planning to also design the individual units, if you're planning to do individual units for that case, if you start off with a bridge design, we can't currently convert that bridge to single units very easily. You would actually have to restart and regenerate the design. So that is a downside. The upside is on the fabrication side. If you're doing 4 units in a row, you got a busy day, you can just splint everything together, just let the mill do its thing. And that way you're not having to continuously load a single unit block. So those are just kind of the pros and cons to splinted units with the bridge BioTemp. The permanent option, we have our BruxZir Now bridge block. The dimensions are a little shorter, so 33 millimeters long by 14 millimeters. This is the full strength version of BruxZir Now, what you currently are using on posterior, on molars. This is the 3Y high strength formulation. This bridge block can be used on both anterior and posterior. So the system does not prevent you from including anterior teeth in the bridge unit. So you can have a mix of anteriors and posteriors, maybe canine to premolars, or even just anteriors alone. So if you're doing a bridge from 8 to 9 or 7 to 9, you can definitely do that with this material. I've seen up to 4. So the system, it's not just what I've seen, the system actually limits you to 4 units for the bridge, so 3 or 4 units. And with the 4 units, it's a maximum, or 3 or 4 units, it's a maximum of 2 abutment teeth or 2 preparations. So, for example, the 4 unit bridge could not have 3 abutments and 1 ponic. It would need to be 2 abutments with 2 ponics. So the system does have a hard limit on 2 preparations, and that's to help preserve the burr, the single-use burr, through the entire milling cycle. Now, as far as the delivery, so cementation-wise, you can use a conventional or adhesive cementation. I'll tend to use an adhesive protocol for shorter preparations. The mill time on this, with it being fully centered BruxZir, about an hour and a half to sometimes up to 2.5 hours of mill time. Now, a couple notes on this. As far as the positioning of the ponic of the bridge doesn't actually have to be between the abutments, so it doesn't have to be prep, ponic, prep. So the system actually does allow you to position a ponic tooth over the edge as a cantilever. So that is an option for both the BioTemps and the BruxZir Now block. So a couple of things to keep in consideration with the design. So we adopt this from bridge designs out in the real world. So we call this the rule of 27. Between the connectors, we want to have enough material to support the restoration. So the rule uses this formula here: the height of the connector squared by the width. We want for that product to be at least 27. So this is an example where it's a real short buccolingual connector or narrow connector. And in this situation, this does violate the rule of 27. This was obviously a little bit exaggerated with the real skinny connectors. But this is, I'm sure, has happened before. We're trying to simulate individualized appearing teeth. You might even use a disc to open up those interproximal areas and inadvertently violate this rule. So what we're really looking for, real tall connector, and of course enough buccolingual width to that connector. And as long as we reach 27 or exceed 27, then that bridge has a better chance of supporting in the long term. So when we get to design, I'll point out how we're going to verify that when we're designing our contacts. So this case here, this patient is missing, let's see, I think that's, so they are missing number 30 and maybe 31. I'm thinking that's number 32 there that has kind of drifted mesially, and you can see how that's quite angled over. The occlusal plane of that tooth is almost vertical. So what I'm kind of looking at here is the occlusal plane where I want to establish the occlusal plane. So factoring this into the preparation, I'm planning to modify the prep and then future design to kind of turn that occlusal plane from vertical to horizontal or more horizontal, factoring in the curvus B. So for the preparation, I'm going to be preparing a little bit more on the distal and a bit more on the mesial to kind of upright the coronal portion of that distal abutment. So basically something like this. And so I'm trying to do so with a 1.5 millimeters of clearance, which we are shooting for with our BruxZir crowns. And that's kind of the outline form of my preparation that I'm shooting for there, right there. So there is the prep. We're gonna, at the time of this, we actually didn't have our BruxZir block available. We had our PMMA block, so we're gonna mill out a PMMA in BioTemps Bridge, so our 3-unit bridge here. And that it's milled in about 25 minutes, and then we seat that down. Now, the final restoration that we made for the patient was a BruxZir Esthetic. So one of the great things is if you want to use another material through the lab that isn't available chairside, and we only have one permanent option chairside in the BruxZir Full Strength or the BruxZir Now, you can send your design to the lab and have them fabricate another material with your design. And so that's what we did here. We did a BruxZir Aesthetic bridge here. And what we're actually seeing here, if you're focused on the distal abutment, we first prepped in 2020, and in 2024, so 4 years later, the patient developed an infection on 32. So this is one of those cases where, I think I had a clever idea of first putting a bridge and modifying that really angled tooth. But I think the forces pushing mesially combined with probably poor hygiene has led to this infection. So that's what I suspect happened here. So kind of this torquing on the mesial side, and we're really kind of pushing the root structures are real angled toward the distal. So that's what I suspect happened here. And so this is unfortunately one of my failures. So from this situation, we're going to plan to remove the tooth. I section the ponic and the distal. So this is just kind of giving a look at where we had started. So it lasted 4 years, but unfortunately, it's always disappointing when this is the outcome. And what we ended up doing after the extractions, we had planned for same day or immediate extractions rather, implants, and then we delivered. These are actually custom abutments with camouflage crowns that we seated over the top of it. You can kind of see some other changes we made on this patient. We did BruxZir Aesthetic veneers more anterior to this area, and that the restoration on 29 is still the BruxZir Aesthetic abutment from the bridge that we retained. So just something to keep in mind, something to consider when it comes to these bridges. We're working in situations that are already compromised with the missing tooth, but we have to kind of envision or imagine how the forces are being directed down the teeth. If we can keep it more along the long axis of the tooth itself, I think that is definitely more favorable. And we understand that with implants too. Implants can't be too angled, otherwise we can definitely run into that same type of situation. All right, another bridge case here. Patient is missing, looks like number 30, 28 and 29 are present. The edentulous space has narrowed quite a bit. Patient would like to fill the opening and have a tooth present. So you can see a couple of fillings already on the planned abutment teeth, a large composite on 31 and an occlusal composite on 29. So the plan for her is to make a BruxZir bridge, but sometimes with the BruxZir bridge, because of the timing, when I'm going to prepare the teeth, I'm planning to first make a BioTemps bridge first, and then provisionalize, and then have the patient return. And sometimes we'll do it next day, or if we do it early enough in the day, we'll have them come back for the final delivery. But in this case, I didn't have time to make the BruxZir Bridge the same day. So the plan is to do a BioTemps Bridge first. So these are the preparations. And when I first prepared these and scanned this in, when you first scan your case in, it's always important to evaluate the scans, especially with bridges now in this case. So for the bridge, we're looking from this bird's eye view. Can we visualize the margins all the way around both abutments from a singular occlusal view? You have to think about the path of insertion. How is this restoration going to seat on both teeth passively? So in this case, I actually have interferences on both the mesial and distal. So the adjacent teeth are, so starting off on 29, the distal surface of 28 is covering the margin. So that is an issue. We would need to open that up. Also on the distal of 29, you can see how the axial aspect of the preparation is covering the margin. So we need to be able to open that up and see the margins. So as long as we eliminate enough of the undercut to expose the margin, that really is the key. And moving on to 31, we can see that adjacent contact of 32 is covering the distal aspect of the margin. So we go back and prepare a little bit more. This is just viewing it in stone, just kind of illustrating it in a different color. And then we go back, make those modifications, do some enamelplasty on both 28 and 31, and exposing the margins. So from this bird's eye view, this is going to allow for passive seat and proper milling of the restoration. So the mill doesn't really care. I know the software pings you or warns you when there's undercuts on the vertical walls of the prep, which is still something important to consider, but really the key is eliminating undercuts for the margin. So enough axial reduction needs to be done on both preps to allow for this singular occlusal passive view of both margins. So keep that in mind after you prepare and scan. Please evaluate those scans to avoid running into any issues. All right, so this is just showing still kind of a real narrow clearance, but I was able to sneak the margins away from those adjacent teeth enough. And so we design, and this is the AI generated design. We're going to see design in a minute. We mill the BioTemps bridge out. There's our bridge. Just really quick on the, so this is just quickly seating it into the milling unit, about 30 minutes to mill this out. But what I really want to get to is the finishing of the bridge and the delivery. This is the BioTemps bridge. So snapping off at the sprue, and here I'm using a fine grit diamond to finish this off. Being extra careful because the PMMA block is much softer compared to if you were finishing sprue with the same burr on a BruxZir. So really gentle. And now we're going to go ahead. We get our passive seat, fortunately, with the corrections to our preparation. The bite is right on. And now for the bonding of this. So what I like to do is now, when it comes to bonding and improving the retention, we need to roughen the intaglio. So you can do this with, here I'm just using a diamond burr, just kind of carefully scoring the axial walls, being real careful to avoid coming into contact with those margins. So we want to preserve the marginal integrity. What's not shown is rinsing and cleaning out any residue from the adjustment. And now we're painting on a thin layer of Scotch Bond Universal, our bonding agent. And we're just making a stickier surface. So this is going to integrate into those roughened channels. Here I'm just air thinning and we're aspirating any excess. And so now we go ahead and light cure, make sure we thin out the solvents and evaporate those solvents in the adhesive. Now on the preparation, we're doing a little bit of desensitizer, being real careful to avoid any freshly cut tissue, which can induce some bleeding. So we let that soak in for at least a minute. We're suctioning off any excess. And now for the cement, we're using what's worked really well in our office is Bifix Temp from Voco, VOCO. This is kind of a resin-based provisional or temporary cement. You can go ahead and light cure it at this point to accelerate the set. And it's really, really easy to remove the excess, which a lot of provisional cements allow for. So we're cleaning off the excess. And this protocol is what we use for really any usage of our BioTemps, single units for bridges, and it holds up extremely well. Now, for less retentive or shorter preparations, I may add an additional coating of bonding agent in select areas on the preparation, away from the margins, kind of on the body of the preparation, just to give the cement a little extra adhesion to the preparation. So this protocol's worked really well. That cement, I can't say enough good things about it, that it's worked really well for us. And roughening the internal of the BioTemps has helped create that roughened surface. So just a quick overview of that protocol: try in and then roughen the intaglia with the diamond or really any burr. You're just making retentive areas, just roughening, transitioning that internal from really smooth to a roughened surface. Remove and rinse off that residue. And then we're applying a thin layer of our bonding agent. Air thin and cure. I know curing, a lot of folks are concerned about curing bonding agent, whether it's on the prep or in the restoration. As long as you thin it out really well, and just kind of make note that visualize to see that the bonding agent's not really pooling or moving around much. That's really, it should be thin enough to avoid any excess film thickness problems during the seat. This Vocal Bifix Temp, that's what we've used the past several years, and it's been fantastic. All right, so in the design software, we can go right back to the same design. We reopen the case, we change the material. In the design phase, from BioTemps to now the BruxZir Now bridge block, and we mill this out. And then we bring the patient back, pop off the provisional bridge, and go ahead and seat our BruxZir bridge. And it's a beautiful result. It looks fantastic with some light polish. And here's a view from the buckle. Now, I decided to use a couple of challenging cases of mine. So to start off with, about a year into service, unfortunately, patient developed radiolucency around number 31. And you can see, just a tough situation. Patient informed me that she started having a lot of discomfort and what I believe the necrosis of the nerve on 31. And this is what I think happened. I think I prepared a little too aggressively. If we look on the buckle, you can see the blushing of the pulp tissue. And there wasn't any active bleeding during the prep, but I suspect that I may have overheated and unfortunately contributed to the death of the nerve. So that's what I suspect happened. It could be additional factors, but this is your reminder today from me that as you prepare, we're always real concerned with our preparations, trying to balance creating enough room and space for our final restorations while also preserving the tooth structure, healthy tooth structure to support our restoration. But this is one of those cases that, I wish I could have been a little bit more careful during the buckle reduction. So that's what I suspect happened. This is one of those failures that hopefully you all can just be careful with. For this patient, we did a similar approach. We did an immediate extraction and same-day implant placements on both 30 and 31. And then this is after the 4 months of healing. And then we fabricated BruxZir screw retain blocks. So these are chairside screw retain blocks that, in case you weren't aware, are now available. Now there's a look from the buckle. And in the end, we're able to deliver restorations for the patient. But it's never a good feeling whenever something that you have done fails and certainly leads to the loss of the underlying tooth. So I want to start off with a couple of my disappointments with bridges, but hopefully you can take something away from that. All right, a couple more examples, and then we will get into the design. So this patient came in with an existing bridge from 7 through 10. They are missing number 9. The treatment plan for this patient is to do an implant at site 9 and then immediately provisionalize the site and have this provisional hold up for the healing of 4 months. So we go ahead and remove the old bridge and prepare and refine the preparations on the abutment teeth 7, 8, and 10. And what I like to do in these situations, I'm planning to make a BioTemps bridge for them. I like to scan the site, design the case, and while it's milling, then come back and perform the surgery. So we scan this, we get our design in, the design of the bridge. And then while it's milling, we go ahead with our surgery. So this is a zirconia, a Ziramex implant. This was something that we were testing quite a few years ago, but we go ahead and seat that down, get the site kind of closed up, and then we go ahead and take our BioTemps bridge. And one thing I want to point out with the bridge, so we all are familiar with the fact that we have a single burr for the entire milling. The burr that we use is a bit rounded on the tip. So if you look at the connector areas, the interproximal, you can see it's a little bit blunted. So if you are wanting to create a little bit more refined, with bridges we're trying to shoot for that individualized appearance. And truthfully, this is in most cases, in most situations, for most patients, I believe it's good enough. But for the real particular, real careful, or keen-eyed patients, and maybe for yourself, if you want to enhance these a little more, you can use a diamond disc, a real narrow diamond disc, and just you transition that embrasure area from a little rounded, blunt area to more of a V shape appearance. So if you're looking at it, you can see this, so rounded, where it's kind of rounded to kind of a V shape using the disc. And I did use a disc a little bit here. So you can see this is kind of where we started, a little bit more of a V through the embrasures on the facial. And that just kind of puts a little bit more of a sharp transition between the teeth just to lend toward the individualized appearance. So we go ahead and seat this down. I use the same exact protocol to bond this in as we saw previously, and it held up for the healing phase. Now, what we ended up doing after we uncovered the case, so just to show you the progress of this case, we went ahead and put a temp cylinder on, and I wanted to try to guide the tissue and train the tissue to have a similar gingival contour as number 8. And you can see here, after I used our water lays to open this up, I was a little concerned I removed too much tissue on the facial. As you can see, it looks like it's more apical than 8. And so we go ahead and rescan the site, and we now make individual biotemps of each tooth. In the design of number 9, we kind of I'm using freeform and just kind of create a shape that matches the same type of emergence profile as number 8. And within a couple of weeks, we bring the patient back for the final impression, and the Ziramex implant didn't have scan body at this time. So you can see how nicely the tissue kind of formed into that zone. So BioTemps, whether single units or bridges, it really does work very well for soft tissue biocompatibility and, like in this case, training the tissue. And what we ended up doing for the patient was BruxZir Esthetic milled BruxZir Esthetic Now restorations with a slight surface characterization. And so that was a good result. So just a quick finalization of that case. So another case here, this patient came in, a lot going on, a lot of PFMs, looks like they're failing on the upper, but we're focused on the lower right now. Patient had a splinted PFM bridge or splinted units from 29 to 31, and number 30 had an infection and was deemed hopeless. So we're going to go ahead and remove the bridge. I'm going to extract and do an immediate implant placement at site 30. And we're going to use a similar protocol to first make our BioTemps bridge after we clean up the preps on 29 and 31. So just a view from the occlusal here. This is after the removal of the original restoration, and you can see number 30 is not looking so great. So we first scan this in. So we scan this in, and in the design software, when you're at the margin page also allows you to modify the prep model. So here I'm using this section here on the left. This is scan repair, the hammer and wrench, and this tool called flatten. And so flatten, what it basically does is, you can see here, I'm sweeping along carefully to concentrate the adjustment right over number 30. And so you can see once it takes action, it just smooths that area out really nicely. So it kind of averages out the surface with kind of a greater tendency to remove material, which in this case is what we want. And so I'm just going back around the borders and just smoothing that out. We also have in the sculpt tool section, the ability to use the remove tool. So this is remove material. And I'm going around on the ridge and just kind of taking that down. And here I'm showing how if we increase the vertical slider bar, how we can accelerate the amount that we're taking away. And so we can also, in the sculpt section, utilize the tool smooth if the area that you smooth is not so smooth, if the transitions are a little bit bumpy or rough. This works really well to just kind of blend that zone together. And then now we can move forward with our design. So now we're going to go ahead and jump into design. I'm going to show you on another case where similar situation, and this is actually now on my grandmother. So one of my grandmothers, she was, I think, 92 at the time of when we did this. She's 95 now and has an infection on number 13. So similar protocol. We're going to go ahead and digitally extract or remove 13, and I'm going to design our bridge. And while the bridge is milling, we're going to extract the tooth. So first, starting off with how we remove number 13. So I want to show you there is a quick way to do so. So here on the left-hand side, we navigate to scan repair, and there is a scissors tool, delete scan data. Almost forgot the name there. So this tool here, from a side view or buccal view, you can actually, this is actually what I did on her on the day of the appointment. I went ahead and cut that away, and you can see it's a quick removal. Now, the upside is it's a fast removal of the tooth. The downside is we have no idea what's going on the ridge, how deep we're going to make the ponic. We're going to most likely make an ovate ponic or an extraction site. But the downside to this method is when we do move forward into design, the AI proposal for the bridge doesn't generate very nicely, or actually it doesn't generate at all. It's not even, not, it just doesn't form because the system gets so confused by this opening. So I'm going to go ahead and undo it. So what should we do instead as an alternative is we can use the flatten tool. So the flatten tool we saw earlier, I'm going to increase the size of this. Anytime you use any of these tools here, add, remove, smooth, or flatten, you want to be real careful as you get close to the preparation, because just to show you, you can smooth away the prep. So that's something we want to avoid. So the flatten tool, I'm gonna go ahead and just start sweeping this along the tooth. Oops, messed up there. Given a lot of examples of what not to do today. So sweeping along with flatten, and you have to be real careful. It takes a little bit of time to just carefully smooth this down. So smoothing around to the lingual, and ultimately we're trying to get rid of it. So now we can kind of more aggressively just kind of sweep continuously over the top. I'm taking it from the tooth to the ridge because the software kind of takes the average of the area we're working on. So you can see we're slowly going down. And I could go ahead and switch to the remove material to try to speed this up, but you can see at some point the flatten can do so eventually, and it does so fairly well. Now at this point, now that the surface is pretty smooth and relatively flat, I'm going to go ahead and use the remove. And with the remove tool, you'll see we first have this horizontal slider bar. This basically defines how the area that we, in this case, remove material, the transition from where we remove, do we want it to be a sharp or smooth transition? So I always like a smooth transition, so I'm going to slide this over to the right. And for the strength, and you can play around with this to determine what's the ideal amount that you want to smooth away. I'm going to start off a little bit lower just to have a bit more control. Sometimes if you bring this too high, it goes really quickly. So if you go quickly, just being real careful. And again, being real careful as we approach the preparations. So here I'm just smoothing out. I'm just making kind of an ovate receptor site on the ridge because we are going to extract number 13. So drop that down a little bit. Now I'm going to smooth around the borders. If you catch that you accidentally touch the preparations or the margins of the adjacent teeth, you can go ahead and undo. But let's say that's good there. I'll probably take this down a little bit more, actually. Let me take this down. Okay. Okay, so that is the adjustment of the ridge to receive the pontic. Now I'm going to return to the margin tool on the left-hand side here, and we're going to finalize the margins. So you can see our preparations are a little bit unconventional. So I'm going to go ahead and adjust the margins on number 12 first. And you can see I left the lingual area of my grandma's tooth more supergingival. So it's kind of more like an onlay, overlay type of preparation. So in this area, I'm going to go ahead and just double click and draw the margin up top. And I was really just trying to get in and out of my grandmother's mouth as quickly as possible because she is a crazy, extreme gagger. And it was really, really difficult to get this prep. So we're going to go ahead and set the margin there. So something like this. And as you can see, no cord was used for my grandmother. Again, I'm just trying to get in and out as quickly as I can. So if you go this route and you're equigingival without cord, you want to make sure you dry the field really well for your scan so you have a chance to visualize where the soft tissue meets the hard tissue. So now that's the margin on 12 for the occlusal arrow. Just kind of point that toward the occlusal area. Now for 14, let's go ahead and just sneak this in. Lingual side, a little overextended slightly. Now, because my grandmother's coming from, she lives up in LA, we're down in Irvine. It's quite a distance and she doesn't like to travel a whole lot. So in this case, we are going to make the BruxZir Bridge and skip over the provisionalization. So that's our planned treatment for her. So we're going to set the margins here. And you can see the preparation. There was a lot of decay there in the center this tooth was endo-treated. So I cleared that area out. And of course, you can do a buildup, but as long as your margins fall outside of any undercuts on the internal walls of your prep, I do have undercuts within there, that's okay. The system is going to build material where it can. It won't build material into the undercuts because the system really lacks the ability to do so. So a little bit, just to, I wanted to show this case to show that you can fabricate something off of a bit more unconventional preparations. So I set the occlusal arrows, set the margins. Let's go ahead and look at our design. Now, even though we use the better method to remove number 13, and when I say better, it means improving our chances of having the AI, the bridge AI, generate our proposal, due to the fact that number 14 has a hollow prep, these endo type preparations, the system does get confused by that. So I'm not banking on the hopes of the AI creating a perfect proposal here. So, and that's good. This is good for this situation because I get to show you if there is a distortion or the AI proposal doesn't generate anything that suits our needs, there's always a way to work around it. And we'll see if we get to that point. Looks like I'm getting a little bit of lag here. So while we wait, I just want to check in. Are there any questions that I can help answer so far?
There are currently no questions, Dr. Chi.
Okay, thank you, Leah. All right, so we're all anxiously awaiting our proposal. You can see the AI is generating, the system is successfully reading the site. So let's see what it comes up with. And I am working with the software team. We're looking at these types of cases to address what we see on the screen. Unfortunately, you can see it kind of blew out that mesial side, and I think it has everything to do with the fact that we have that hollowed out preparation. It actually did a really good job on 28. So, or not 28, I'm looking at this like it's a lower. That's 12. All right, so let's go to, if this happens, I know the first step most of you will take is call support, which is great. They are there and ready, but I want to arm you with the ability to do this on your own. So let's navigate to proposal. So left-hand column, first icon. And in the dropdown, we're going to now change this to library. All right, so in this case, because the connector was also blown out, we could try to work off of this. Let me actually just see if we did that. So when we go to library, when you go to this library section, on the bottom here, we go to adjust, and this takes us into what's called arch mode. So this section allows us to define the starting point of the library teeth. So the library teeth is just our generic good anatomical contour of, in this case, 12, 13, and 14. So what I like to do, we're going to go ahead and set the library for all three of the teeth. And right now, what I like to do first from an occlusal view is to define the size, angulation, and the general position of each of these. So I like to work on the abutment teeth first. So let's start off on number 12. And so I'm first starting off by centering it over the preparation. And from this point, I'm evaluating the size of this. Do we need to expand this to the buccal or lingual? In this section, when we use these expansion or contraction tools, it does adjust both the buccal and lingual together and same mesial distally. So this is how we can increase the size of the library tooth. And from that occlusal view, another change that we can make is rotate the tooth if we need to. But I like the alignment of where it's at right now. So we're going to leave that there. And now I'm going to go ahead and check. We're going to finish our adjustment on 12. I'm checking from the buccal here. I'm looking to see, does this library tooth does its length cover the whole preparation? In this case, you can see how it's a little short from the margin. So what I like to do here, I'm going to go ahead and expand this toward the occlusal. As I do that, it expands to the margins as well, apically. And so now that I've made it tall, we can go ahead and move the whole design into the preparation. So dropping this down to about where it's level with number 11. All right. So from this buccal view, we can also adjust the long axis angulation. It's not going to be too far off, maybe a little bit more vertical compared to the canines typically, but more or less close in alignment. Like we wouldn't want it to be like that or too far to the mesial. So we're going to keep this upright, centered over the prep. So we got the size, we've got the angulation. I also like to check from this buccal view, kind of the buccal contour. Does it flow with the neighboring teeth? If we had distal tooth, we can also compare to there as well. But this flows really nicely. If we had to change the angulation, it would be something like this. So that buccal contour flows with number 11 nicely. And one final check that we can look at is with the opposing, we want for the buccal to be beyond the buccal in normal occlusion, beyond the buccal of the lower. And here we can see on the lingual, the position of our functional area, how it's interacting with the opposing. And we're going to make that adjustment to the heavy spot once we define or set the design. So we're going to leave this right here. Now with multiple units, multiple individual restorations, or in this case with the bridge, before you move on to the next design or library tooth, we're going to utilize this tool here on the upper left called pin tooth. So we're going to go ahead and click pin and single left click on number 12. And so now the reason we do that is because when we adjust the library tooth, you can see how they affect one another if they're all unpinned. So because we've pinned 12, it no longer will affect the position or size. So before we go on to 13, because the space of the ponic usually is compromised with missing tooth, or it more likely is compromised than the other preparations, I like to work on the abutment teeth first, because the abutment teeth, we want for those to be a little more ideal. If we're going to compromise on the size of a tooth, we're going to pull away from the ponic. Or at least that is the recommendation. So we're going to basically get the size of both 12 and 14 to their ideal. Now it's starting off, we center over the prep of 14, which is about here. And the size of the tooth, I like to go a little bit bigger than the preparation, clearly. So a little bit bigger than the preparation. So this looks pretty good from the occlusal. No real rotation necessary. The central grooves line up fairly well, aligned with the other teeth. Now let's look from the buccal. Now from the buccal, we can see here, it's pretty much in line, maybe a little shorter. Let me lengthen the tooth a little bit just to see what's going on here. And now we can see there's a little bit of contact forming on the buccal, which is not really what we want. If this would be in contact, if the tooth is in cross section, but this is where it's helpful now to not just design on the upper, let's look at the lower. And so we can see that now bumping into number 19. So what I'll do here is use the rotation and let me rotate this tooth toward the buccal. And that basically elevates this buccal area away. We want this overlap. Whenever teeth are edge to edge, so you can see, for example, if we move this way, if we design for that buccal cusp to hit the buccal directly on the lower, there's a greater risk of cheek biting in those situations. So this overlap is really, really important. So we change the angulation toward the buccal, making sure there's clearance over the buccal, and that looks pretty good. Now from this buccal view, maybe the distal is slightly low. So let's see if we angle in this direction, if that just kind of straighten out and even out the occlusal plane area. And that looks pretty good there. So let's look at this from the lingual. So from the lingual, we want to see in normal occlusion, which my grandma does have. So we want for the lingual cusp of the upper teeth to fit in the central fossa or middle area of the opposing. And that's how the patient can more effectively function with their teeth. So that's the general position we want. So that looks pretty good. Let me hide the lower for a second. So we can see those contact areas, and they're going to start off a little heavy, but we'll go through how we adjust that down. So now I'll go to pin tooth. We improve the location, we improve the angulation. Let's go ahead and pin that down. So now we're going to uncheck the pin tooth because we have one more tooth to work on, and that is 13. So from this occlusal aspect, a little narrow mesial distally, so let's go ahead and widen it. A little narrow buccolingually, we'll widen it to get a similar width, buccolingual width as 12. And that looks pretty good. So basically we widen until we touch both 12 and 14. And it's okay to go a little heavier because that is how we generate our nice contact areas and connector areas. So that's the occlusal view. Let's look at this from the buccal. So from the buccal, you can probably immediately see the long axis angulation is a little bit mesially inclined. Let's rotate this to get this more in line with the other teeth. Rotating this to the distal, making sure we still maintain contact between the teeth. We can see the occlusal surface or the buccal cusp pretty much in alignment. Maybe it's a little long compared to the molar. We can see down this buccal corridor what that looks like. Maybe it can go up slightly. Okay. And so now from this view, we pretty much exhausted it. It looks like it flows with the adjacent teeth fairly well. The last thing I want to check is its functional position against the opposing. So making sure we have clearance past the buccal of the lowers, which we do have. Looking from the lingual, and actually from this view, I can see how the buccal kind of dips in a little bit more toward the lingual. So like we did for the molar, we're going to do a little rotation this way, and you can see how we get that into better alignment. It matches the other teeth a bit better. It flows better. All right, so now the lingual cusp of 12 and 13 now, what we're working on, is hitting the middle, so that looks good. So you can see the importance of using the library. When you are in the library, there is a little bit more work there, but you have control over the starting point of the design. So we're going to go ahead and hit apply once we've completed all of those adjustments. At this point, if you notice something that the pin teeth could improve on, what you can do is you can pin upon it, and then you can unpin the others and go about additional adjustments if necessary. But otherwise, this looks pretty good. Let's go ahead and hit apply, and hopefully the new design is improved. So it actually, notice how it actually saved the AI proposals for 12 and 13. So going back to this, if we want to go to, let me go to proposal. Let's go, we're on 13 now. Let's change this to library. This is how we switch to the library tooth. Let's go to 12 and let's go to library. And this is what we had generated in that section. So I want to make sure we go through the whole library workflow to show how we're going to work through this case. Okay, so now that we're at this point, so let's start off with what I like to do actually is to start off with the ponic, because the ponic, when we are on the ponic, we can activate the contacts window. We're going to first try to use an automated method to improve on our contacts. So looking at the bottom of the contacts window, you can see with multiple designs, we have this tool, Show Contact Plane. So with Show Contact Plane, when the ponic is active, you have both contact areas with the plane. So this is kind of why I like to start with the ponic rather than the abutment teeth first, where if you were on the abutment teeth, you're only going to adjust one contact area at a time. So with these planes, you have 3 adjustments. You can slide the plane side to side into the position where you want the contact area to be. And where I set it in the library section is about where I want the contacts. But generally, we want for the contact areas to be slightly away from the abutment margins. So meaning you don't want it to be too close to here. So where this contact area is, and you can see we have kind of an even emergence profile. That's kind of the goal with our restorations. Similar emergence profiles, easier to clean. All right, so side-to-side positioning of the plane is movement number one. The other couple adjustments you can make are with the red circles, so you can change the buccolingual angulation, and you can also change the occlusal gingival angulation as well. But I'm going to keep these, generally just keep these fairly vertical. All right, so with the positioning of the plane, what we can now do is in the context window with bridges, this is the only time these numbers don't indicate microns or aren't displaying microns. So normally when there's 100 here, that means 1/10 of a millimeter or 100 microns. This is the rule of 27 in action. So the software, it's not important for you to remember that formula because the software does it for you. And as you can see, this is a great example. The mesial side, it says 0 BC for bridge contact. That means we don't have a heavy enough contact. On the distal, we do. When it's at least 27, it turns green. So what we'll do is we're going to leave this at 27. And I'm curious too, I always have just left this at 27. Let's see what happens if we bump this up to 40. I want to see if the software does a good job of increasing it. So let's go to 40, 40. And now that the contact planes are on, when we hit fixed contacts, the software should adapt the contact areas to about the area where the planes are. So let's see it kind of do its thing, wiggling back and forth. The final adjustment for the occlusion to -400. So the benefit of activating the planes, leaving it on, is, again, the software is supposed to try to keep that contact area about in that zone. If the planes are not activated, the software might shift the contact areas either too close to the abutment teeth or maybe too far away. So this just gives a little bit more control when using the automated function for those contacts. All right, so not quite 40, but it did bump both sides up a little bit. I think part of the limitation is the way the software is creating the contact area. It's only doing so on the ponic itself. Maybe the contours of the adjacent teeth. It would be nice if it was able to adjust those at the same time. But just to show you, I can use freeform now. And actually, let's say you really want to beef up those contact areas even more. As you expand the designs, you can now see how it's very easily able to go beyond the 40 that we had wanted. All right, so just going back to, so that's the adjustment for the ponic. Let's go back and look at now number 12. I know we're kind of coming up on time, so I'm gonna go ahead and get through this a little more quickly. So looking at the contour of 12, you can see kind of due to the narrowness of the prep, it kind of squeezed near the margin, so near the gingival area. I'm just using free form from this bird's eye view, kind of improving that buccal contour of the design. And on the mesial contact, we do have a nice contact, but I can also manually create a broader contact against number 11 here. So this is an option. All right, so now for the heaviness of the contact. When the starting point is really heavy, what I like to do is, if you still plan to use the automated function, I still like to pre-move these areas down a little bit because that reduces the amount of adjustment for the software. When the software tends to have a lot to adjust, it could potentially lead to some distortions. So what we'll do now is go to the contact window again. I'll reactivate the plane to tell the software this is about where we want the contacts. Don't or preserve this position. And let's give this a try. So let's go to fix contact. And that looks pretty good. Now, on terminal restoration, so something to point out, terminal restorations meaning we don't have a distal neighbor. If there was a tooth distal to our distal abutment, it would actually change the parameters for the contact on the mesial of number 12 here. So normally we set that by default to 0, but the software automatically bumps that up. So something to keep in mind, that is just to ensure we get a good contact when there is no distal contact tooth or distal neighbor. So it's the same applied for single unit restoration as well. If you're working on the last tooth in the quadrant, the mesial contact will be automatically a bit heavier. Okay, so now let's go to 14. Again, I'll maybe pre-lower some of these heavy contact areas just to see this incline here, maybe still a little bit close to the opposing buccal. So I'm just going to move this away. Yes, I'm getting this area a little bit thin, but whenever we go to try the fixed contacts, let's turn the plane on and we'll go to fixed contacts. The software will fill in that thin area, a little wiggling of the contact. We're trying to define that position. We don't want it to go away from that zone, which is what the plane is defining, and it locks that in. So that is our design. We have a nice looking, everything is in its functional position. The connector areas are of adequate size, which is beyond 27. And we can go ahead and now mill this out. So let me go back to the slideshow here. And so back to the previous case that I started with the extraction, we have the BioTemps crown or bridge milling, and we go through our extraction, immediate placement. That's a Glidewell HT50 implant, suture it up, and then we have our BioTemps ready to go. And so this hangs on for the 4 months of healing time. And I really, really enjoy the BioTemps Now bridge for this type of application. And I apologize, I don't have a final of my grandmother's BruxZir bridge, but 2 hours later, after post-extraction, we got a little lunch. We came back and delivered that bridge, and it's holding up really well. I'm going to quickly jump through. I know we're kind of at time, but let me just quickly show a couple of other things with this BruxZir or BioTemp bridge application. Just one more example. This is actually on my maternal grandmother, my other grandmother. So we have a tooth number 8 that needs to come out. And what you're actually looking at are 6-year-old camouflage veneers. We have 10 veneers, 4 through 13. Unfortunately, number 8, it was already kind of borderline compromised when we initially did this, but you know, wanted to try to keep the tooth as long as possible. But number 8 needs to go. But we go ahead and prepare 7 and 9 to receive a bridge. And while it's milling, the extraction is performed, and then we have our BioTemps bridge. And so you can see on the buccal here, I did a little bit of embrasure refinement with a diamond disc and a little needle, narrow diamond to kind of open up that gingival embrasure just to kind of make the appearance a bit better. And I'll be honest, this case here, because this grandmother also lives kind of far away, I didn't want her to have to come back. I went ahead and permanently cemented this bridge in, and it's holding up really well. And for her lower, this is also my grandma, the same grandma here. She had a partial on the lower. And we actually, a few years ago, did a BruxZir Now survey crown on, you can see number 31. And so I showed this case at some of our intro CAD/CAM courses, and I had a doc ask me why I didn't do bridges for her, and my answer was I needed to have a crown under a partial using the pre-treatment protocol. But that really triggered in my mind at that point, why don't I just now do bridges on her? So we brought her back, and I'm going to do a bridge from 18 to 21 and a bridge from 28 to 31. Now, because she's coming from far away, and the BruxZir Bridge is not long enough. And the reason why we're going to 21 is because number 20 is a little bit mobile. So I want to have additional stability by adding in number 21. So I went ahead and made BioTemps bridges for her and permanently cemented them. So I roughened the intaglio, we bonded in, and we used the BruxZir cement to lock these in. And they've been holding up well for the last 8 months. And I check them often, but it's holding up. And there's no reason why. I know it's PMMA, and it is the weakest material, and we're so used to our high strength materials, but as long as you have good preparations, enough adequate thickness, I can't imagine this not holding up well for the long term. So just to look at the dimensions of the designs of the bridges and the blocks, we really were near the limit. So you can see our 5 units on the lower left and our 4 units on the lower right, and pretty much maxed these out. Now, my grandmother has a pretty severe or significant curve of speed. So looking at this from the buccal side here, you can see this is something that you really need to factor in when this is the case. So I actually under-reduced on the mesial aspect of 18. I did not get that quite vertical enough. And so in the software, what I did was, this is a view from the insertion direction, which I didn't show on the previous design, but something really important to evaluate is that insertion direction. But what I had to do was, I didn't notice this. I know I said this earlier, to really evaluate the scans beforehand, but I didn't notice until we got to the design page or marking the margins, and I realized, wow, this margin on the mesial is in the undercut. This wall was too far out. So I use the smooth and the remove material function like we saw where we took the tooth away, and I basically prepped away digitally material from the mesial side of that tooth. And I actually did the same thing on number 31, because that also was under reduced on the mesial side. So I smoothed it out, we milled the restorations out, and during the seating, a little bit of adjustment to the inside of the bridges, but more adjustment to the preparations to get those to draw passively. So for these reasons, I don't love doing bridges, but just an additional kind of real important variable for our bridges that we have to consider, especially when the different abutment teeth are going in different directions, different long axes positions, considering how we're creating the final occlusal and functional positions to allow for proper force transfer through the tooth that we saw the first example, unfortunately, I believe, led to its demise. So something also interesting on this case, that BruxZir crown that we had on 31, I decided to do a crown prep directly on it. Something I don't advise doing. It definitely took a bit more effort than I was hoping for, but we did a crown prep on it. So we've got a BioTemps bridge distal abutment with the crown, I guess a crown of zirconia BruxZir Now abutment over the top of it. That's holding up pretty well. And I didn't want to take that crown off because the original tooth had the original preparation. There was a furcal involvement. It was already really compromised to begin with. So I just thought leaving that zirconia base to support this bridge might be better. But this was the BioTemps bridge, again, permanently cemented with the BruxZir cement with post roughening of the inside. All right, so I'm going to go ahead and respect your time. I'm going to turn it over to Leah and Helen to see if there are any questions.
Hi, Dr. Chi. So we have a question for you. How did you mill a bridge with 3 abutments? When I tried to mill a BruxZir Now bridge, it only allowed 2 abutments, even though it completely fit within the block.
So for the BruxZir bridge, you can only do a maximum of 2 abutments. So the fact that you had a 3rd abutment is why it wouldn't allow it. I didn't actually get it to mill Oh, so you're probably thinking about my grandmother's bridge. The BioTemp allows for you to, it doesn't matter how, there's no limit to the abutment. So like in this case, I have an abutment on 18, 20, and 21. It's only possible with the BioTemp bridge. If this was a shorter span and it fit the BruxZir bridge block, let's say there was only one ponic, we could not do that with the BruxZir bridge. And that's something that we're going to inquire about. If there is a desire, I'm not sure the use case, like if it really, because what the reason why we're limiting it to 2 abutments is to preserve the burr. And so that additional abutment can potentially lead to additional wear of the burr. It definitely will lead to additional wear of the burr and potentially not complete the milling cycle correctly. Thanks for the question. Sorry about that. If you do run into that case, unfortunately, BruxZir bridges with multiple greater than 2 abutments would need to be done in the lab.
Next question is, can we do Maryland bridges and cantilever bridges?
So it's not an official indication. The Maryland bridge, there is a bit of a workaround for it. We do have a design video where I show the workaround, and it's quite involved. You have to basically first make a simulated prep over the edentulous site and manually create a wing that extends. And it's only a single wing Maryland bridge, which is more favorable now that in recent studies. So a single wing approach, and you have to make the wing yourself using freeform, a combination of the sculpt tools. It is possible, and maybe we can cover that at a later time. The cantilever bridge, the system does allow for cantilever bridges. So let's say, like in this situation, maybe 19's missing, or rather 20's missing, and you can cantilever. It's better to cantilever off of a big tooth to a smaller tooth. So if 20's missing, you can cantilever. You can do a bridge from 19 to 20. I wouldn't advise 20 abutment with a 19 cantilever. That most likely won't work very well. 20 is gonna, given the examples today, I think will not survive that for too long. But cantilevers are possible. In the software, when you set the case up, you just choose your abutments and then select whatever ponic you want off the end of it. You can also set the case up with 2 abutments. So you could do, going back to the example of cantilever 19, you could do 20 and 21 as your abutments in BruxZir. So again, 2 abutments maximum. So side-by-side abutments with the cantilever going to 19 or the cantilever going to 22. So that is possible. Anything else?
That was all the questions, Dr. Chi.
All right. I hope that was helpful. If y'all have any questions, please feel free to reach out to us. And but otherwise, we'll see you guys on the next one. Hope y'all have a great weekend.
Thank you, everybody.